Hi, everybody. I am here to talk about why the U.S. needs universal health care, but Katie already did that for me. So thank you, Katie. I'm sort of a latecomer to the single-payer dance, but I come at it from several different viewpoints. I'm a certified clinical herbalist and energy worker, and in my private practice I had many clients who had no access to, quote, regular health care, unquote. So they would come to me desperate for some help, and they knew they could pay me with food or car repair or, in one case, bags of cat litter. I also have worked for the last 16 years in the HIV and AIDS field, first as an alternative therapist, and now I am, as Sylvia said, copy editor of Positively Aware magazine, which I believe is the nation's best HIV and AIDS treatment journal. And in 2008, a confluence of work stress and genetics and aging put me in the hospital for 4 uninsured days. The result of that was $30,000 worth of medical debt, a pittance compared to Katie's story, but it was a big mountain for me. 5 new diagnoses which require quarterly or biannual visits to a primary care doc, as well as 5 specialists. In 2009, I had no idea that there was such a thing as single-payer health care, or anyone advocating for it. But out of my desperation, I began to learn. And I learned that there were millions of people who had insurance and who every day had to choose between food and health care, or paying their rent or mortgage or health care. There were parents that had to choose between their health care and their children's health care. And I realized that this was something that I was here to do something about. It was a purpose in my life, and so therefore I thank all of my 5 comorbidities for bringing me to that realization. Right now, in this country, we have a situation unlike any other rich industrial country in the world. And Rick Santorum was right when he refused to believe that 55,000 people die every year because of lack of access to health care, because really the new number is 88,000. But I'd like to talk to you now about some promising numbers. Have you ever noticed how any law that has anything to do with money never tells you in dollar amounts what that's going to mean to you? We have 2 major bills in Congress. There's H.R. 676, the Expanded and Improved Medicare for All Act, which would provide a national tax-based healthcare system. And then we have the companion bills, S-915 and H.R. 1200, the American Health Security Act, which would provide for the states coming up with their own individual single-payer systems. There's no funding language in H.R. 676, but there have been estimates and proposals put out by the staff of Congressman John Conyers, who's the sponsor. There is funding language in the American Health Security Act, and I've sort of combined the 2 proposals to create a cost comparison chart. And this is a chart of my actual expenses in 2010 compared to what I would have paid under a single-payer system. As you can see, I would have saved over $4,000. And really, one of the things that you can't quantify, as Katie so aptly demonstrated, the amount of cost of the stress and the worry and the fear and the struggle and the arguing with health insurance companies on the phone. There's no dollar amount that's attached to that, but it's a huge human cost. And then there is the effect on businesses. This is a chart that shows the 2011 costs for the agency that I work at. It's a nonprofit HIV and AIDS service agency with 45 covered employees. Because so many of my coworkers are HIV positive themselves, we have gold standard Blue Cross Blue Shield insurance. However, the day after the ACA was passed, our insurance agent came in and told us that our co-pays for seeing our doctors were going to go up from $10 per visit to $20 per visit for a primary care doc and $40 per visit for a specialist. $40 is half my weekly food budget, so I don't see my specialists anymore. Some of my HIV positive coworkers really went into sort of panic mode. And in Illinois, which you may have heard is the poorest state in the nation at this point in terms of state debt, even though our AIDS drug assistance program is still in effect, they are cutting eligibility, they're cutting the formulary, and people who are on HIV meds are looking at the dire consequences of not being able to get their medication. This not only has individual effects on them, but it also has a public health component in that if the virus is not suppressed by medication, the infection rates are higher. So as you can see, my agency would have saved over $95,000. And in our world, that's the salaries of 3 full-time employees, or it's funding for 2 new programs, or finally, perhaps upgrading our computer system, which is from 2003. It would make a huge difference. So these are the sort of numbers that nobody is talking about. And I think it's one of the mistakes that we as single-payer advocates make. We don't try to nail down these numbers, and we don't talk about them. If we do, people are like, whoa, sign me up. Because obviously nobody wants to spend $4,000 more than they have to spend on their health care. So anyway, those are the charts. So how do we get to the point where we have this system? The how-to is always the big problem. And we're here in this room, all of us humanitarians can agree that healthcare is a human right that should be available to all. But unfortunately, not everyone is a humanitarian, at least not yet, especially in the insurance companies. So I believe that if we're to succeed in our efforts, we sort of have to look at ourselves first. And we have to realize that we're doing too much preaching to the choir. We have to go outside of our choir, and we have to communicate to those who right now might dismiss us as bleeding heart liberals. And we have to redefine ourselves as kick-ass liberals. We need to have loud, proud, relentless representation. We need to demand universal health care, not ask for it. It's time to stop being polite and politically correct and really insist on what we need in this country. We need to rev up, speak out, show up, and be the change that we want to see. I know that's a much used phrase, but in this case it does apply. We need to meet the opposition spin machine with consistent factual answers. And this is the big thing. We must never let a lie go unchallenged. They instantly let them get away with calling Obamacare universal health care. Then we've set ourselves back. I can't tell you how many people have come by my table here thinking that Obamacare is universal health care. There obviously needs to be some education going on there, and we're all individually responsible for that. But there also needs to be, a greater consciousness in the public. And I've searched my brain to try and figure out how to achieve that. And I think that, one of the ways to do that, I've skip a place. Many of the single-payer advocates that I know have negative or hostile attitudes towards legislators, and that's one of the things we skip. We can't have laws without legislators. And legislators are not all corrupt, evil people. Many of them went into public service with great humanitarian intent. And it's those legislators that we have to develop productive, positive relationships with. And we have to be there with answers to motivate them to do the things that they're going to feel good about, better perhaps than taking money from a pharmaceutical company. You know, there are trade-offs, obviously. If you know that you're going to need millions to run a campaign, well, feeling good about the work that you do when you're in the legislature is not going to really help your bottom line. But on the other hand, I believe that if we can find the ones that went into politics for a reason to help change the world or to help benefit humanity, those are the people that we need to tap. And we need to remind the other ones that that is a possibility. We also need to change some hearts and minds. Republicans, business people, unions that aren't already with us, medical providers that aren't on board, yes, even pharmaceutical company people. And we have plenty of proof that these kinds of folks can be good allies. David Stile, who's the president of the Board for Healthcare for All Pennsylvania, is a Republican, a former state legislator, and a business owner. We have great union allies, the UAW, the AFL-CIO, their National Nurses Union. We need to reach out to other unions because really, wouldn't it be wonderful if labor and management didn't have to fight over health care benefits every time a contract was negotiated? And when I was at the recent United States Conference on AIDS, I had two pharmaceutical representatives from Merck and Gilead tell me that most of the representatives in the field are all for single payer. So we need to get the frontline people to start informing the executives. And there are millions of so-called average Americans, people like you and me, who struggle daily. Their own health problems of the ones they love, and they're hearing way more from our opposition than they're hearing from us. So this comes again to the communication thing. We need to find them, reach out to them, educate them, and motivate them. And we also need to take advantage of two particular circumstances that are going on right now. We are in a place in American history when there's a political awakening like there's never been before in my lifetime anyway, and as far back as I can remember. There's a wave of people sort of shaking themselves out of complacency. It started with the protests in Madison and other states where laws against workers' rights were being illegally passed, and it's being spread through the wildfire of the Occupy movement. And that is something that we need to tap into. People who, before now, maybe they voted, maybe they didn't really care. Now suddenly they're doing their homework and they're making good electoral informed choices. Those are the kinds of people that we need to communicate with. And they communicate with people who are themselves complacent. It's sort of that, again, the tipping point of spreading the information. Second is the Supreme Court's ruling on the Patient Protection and Affordable Care Act. And let me just say a word here. I think it's important for people who consider themselves to be single-payer advocates and liberals. I think it's important to separate being against the ACA from being for President Obama. I myself was on his health care committee in his campaign in 2008, and I know that what he got was not what he wanted. I think that we need to realize that he is not responsible for the final product. And I don't believe that he likes it any more than we do. But we need to make him go further. We need to make him hear our demand for universal health care. Because then I really do believe that he will act. And we need to be there when the Supreme Court ruling comes down. Whatever it is, it's opened a huge door of opportunity for the single-payer movement. So we need to beat the right, conservative Republicans to the microphones. We need to beat them to the television cameras and the newspaper columns and the blogs. Because as soon as all this snafu occurred, the blogosphere was alive suddenly with articles and comments and statistics that were positive about single payer. So we need to keep that momentum going. And especially now that there are relentless attacks on Medicare and Medicaid, people are more curious. Well, what else is there? What are the other alternatives? And we need to be there, right there, saying single payer relentlessly. Because that way, they'll want to learn more about it, and they'll consider it as a possibility. Sooner or later, bottom line is everyone asks themselves, what's going to happen to me? And so, if they are right now on Medicaid, or as Katie is trying to be on Medicaid or Medicare, that's something that we can use to argue our cause. And we also need to develop a network, a better network than we already have, and a focus of connection, and that's where Doug comes in. I really sort of developed this in relationship to the AIDS activism of the 1990s. That small group of men actually got the pharmaceutical companies to fall into line. And they did it by being loud and proud and relentless. And in 1963, 250,000 people showed up on the National Mall to demand freedom through civil rights laws. They came on foot, in cars and trucks and buses, on trains and planes. They were black and white, male and female, sharecroppers, store owners, ministers, and movie stars. They stood in the hot August sun and listened for hours to powerful speeches, from John Lewis's refusal to be patient and wait, to Martin Luther King's description of his dream. I believe this is what we need. A mobilization that is that big, and the commonalities, the commonalities between the fight for civil rights and the battle for universal health care are the fuel that fuels my vision here. There are so many commonalities with so many struggles for the 99%, for voters' rights, for workers' rights, for women's rights, for sound environmental and energy policy. Let's face it, there is no shortage of wrongs to be righted. And I think that pulling together like this is one of the ways that we can address that. And that day, in John Lewis's speech, he said, we must all recognize the fact that if any radical social, political, and economic changes are to be made in our society, it is the people, the masses, that must bring them about. It sort of always makes me cry to think about this. Less than a year later, on July 2nd, 1964, all these 250,000 people won. The Civil Rights Act was passed and signed into law. And I believe we can win too. None of those people came because they thought they themselves were going to make the difference or be the tipping point to cause the victory, but they had hope and faith. And they had courage, I think, because they went against the prevailing societal mass consciousness.
Yeah.
They had the courage to stand up and say, we demand freedom. We demand our right to freedom. It's going to take a mighty leap of faith to recreate this kind of mobilization. And in this day and age of cynicism and having to prove that what's in it for them to get people to support a cause, moving the masses is going to be a Herculean task. But I believe we can do it. Maybe I'm naive. It's certainly going to be more time-consuming and more expensive than it was in 1963. But again, I believe we can do it. We can win too. And let me echo Mr. Lewis's words again. When he said, we must say, wake up, America, wake up, because we cannot stop and we will not be patient. Thank you.